not only you pull that out of the hole.
Can't hear you.
Can't hear you.
Can't hear you.
There you go.
All right. About Obamacare, which is the Patient Protection and Affordable Care Act, mandated the expansion of Medicaid to individuals earning up to 138% of the federal poverty level. That was originally in the Obamacare bill. Individuals making up to $50,600 a year, families with incomes up to $32,000 a year would qualify. Up to 600,000 Ohioans would qualify. As part of Obamacare, any state refusing to expand Medicaid would lose all federal subsidies to current Medicaid recipients. This was the original proposal. But 26 states, including Ohio, challenged Obamacare in the courts, in the Supreme Court. So in 2012, the U.S. Supreme Court struck down as unconstitutional the mandate requiring states to expand Medicaid. They said it was too corrosive, or too corrosive, yeah. So, as a result, Medicaid expansion by the states is now voluntary. And this is the governor's justification for expanding Medicaid in Ohio. Remember that he was against it in the first place, against the Health Care Act. It would provide lower-income Ohioans better access to primary care physicians. It is consistent with his personal beliefs about helping people. It would guarantee the return of Ohioans' federal tax dollars to Ohio. The federal government will fund 100% of the program cost from 2014 to 2017 and 90% of the cost thereafter. That's what they say. So, refusing the federal funds will place Ohio at an economic disadvantage with other states. This is why the government wants to do this. Expanding Medicaid will reduce emergency room use, thus lowering the overall cost of health care in Ohio. Expanding Medicaid will help more businesses in Ohio be competitive. A circuit breaker clause in the budget will allow Ohio to opt out if the federal government reduces the amount of Medicaid funding it provides to the state. And that circuit breaker clause could be taken to the Supreme Court and struck down just like the mandate was. By the numbers, the facts for the Governor's Office of Health Transformation. Okay, so even chart how many people would be enrolled by 2015, and how many would be by 2020. And this number of Ohioans expected to lose eligibility, what they're referring to is they would not be eligible in the current Medicaid law. And then there would be people who would not be covered under this because they would be taking the tax, the subsidies. Yeah, that's what that is. And this would be the net adds Medicaid program in Ohio. And that would be the funding for the federal government. And another point which has probably come up to is that this is going to cover everybody up to 138% of the federal poverty level. As it used to be just women, pregnant women, children, and that was it. Now it's going to be even able-bodied people who are not making enough money. So budget proponents of the government's proposal say Medicaid mandates through EMTALA, that's the emergency law, the Emergency Act, the Emergency Treatment and Labor Act that was passed in 1986 by Reagan, that requires hospitals to treat illegal immigrants and anybody comes in the hospital. Then they have to make, they have to stabilize them. They have to, and then they have to figure out if they just put them, in another hospital that's better for them. But they have to be stabilized, and people have to be aware of what they are doing. So that was passed in 1986, but it's not funded, so they don't have to pay. Currently, the federal government. Currently, the federal government compensates hospitals for taking care of the uninsured by making disproportionate share hospital payments. In fiscal 2014, Obamacare cuts DSH payments to hospitals by 75%. So it's making it harder for, it's making it harder for the hospitals to afford this kind of care, but, that's Obamacare. Expanding Medicaid will reduce the number of uninsured patients who will have to be cared for in Ohio hospitals. Expanding Medicaid will help the 1.5 million people in Ohio currently without health insurance. Expanding Medicaid will offset the cost of uncompensated health care provided by physicians and hospitals, and Ohio's economy will be boosted by up to $25 billion in additional federal funding over a 10-year period. Expanding Medicaid will lower the impact of caring for the uninsured and reduce the need for higher insurance premiums. Businesses employing low-wage workers will be able to steer their employees toward Medicaid and thus avoid the cost of having to provide private health care insurance. State government is obligated to expand health care for all Ohioans. And what do the critics of the government proposal say? Medicaid doesn't need to be expanded. It's incurred millions of dollars of fraud and waste that needs to be reformed. Medicaid is growing broke. We shouldn't be adding to a deeply flawed, already overburdened system. And the Medicaid enrollees have worse access and outcomes than privately insured individuals. 1 in 3 physicians already refuse to accept Medicaid because of low reimbursement rates and additional paperwork and bureaucracy. Medicaid was intended to serve seniors and children. Up to 90% of new enrollees will be able-bodied young adults. There is no work requirement or incentive to increase one's earnings. Expanding Medicaid promotes greater dependency on big government. Medicaid's expansion will add trillions of dollars to America's national debt. It's not really, obviously it's not free money, it's out of our taxes. It's unsustainable without further tax increases on America's middle class. Medicaid currently makes up 35% of the state of Ohio's current budget. With this expansion, it will grow to 54%. Eventually, the state will need to either cut other programs or increase taxes. Contrary to proponents' claims, the majority of hospitals in Ohio report positive net income without additional charity offset subsidies. The hospitals who really have trouble are in rural areas. Expanding Medicaid will mainly benefit special interest groups, hospitals that are banking on future increases in Medicaid payments, insurance carriers, and business that want taxpayers to pay for their employees' health care. Medicaid expansion will actually drive up premiums for other Ohioans because hospitals will make up for the cost of Medicaid's underpayment by charging more to people with private insurance, a phenomenon known as cost shifting. For every dollar that Ohio hospitals spend caring for Medicaid patients, Medicaid pays 83 cents. Expanding Medicaid will increase the charity case losses and increase the overall cost. The Medicaid expansion is part of Barack Obama's larger goal of eventually pushing patients into a single-payer, government-run health care system. They will be pushing out the private insurance also. The implementation of Obamacare depends on expanding Medicaid. As an opponent of Obamacare, Governor Kasich should oppose expansion of Medicaid. Governor Kasich is appealing to liberal voting blocs who are going to rally against him in 2014 anyway. The governor's claim that he's knocked out of Medicaid expansion if federal funding stops is dubious at best. The Supreme Court ruling stated only that states can refuse to participate at the outset. It said nothing about future opt-outs. How likely is it that a future governor will roll back a program once it has added up to 600,000 people to its system. In support of expanding Medicaid in Ohio, the Ohio Alliance for Health Transformation, the Ohio Hospital Association, which is right now very busily having all their employees, volunteers, patients calling the legislature and advertising on the radio in support of that. The Greater Cleveland Partnership, Greater Cleveland Congregation, the Universal Healthcare Action Network, Ohio Right to Life, Ohio Medical Association. And then opposed to expanding Medicaid in Ohio is 65% of Ohio Republican voters, the Ohio Liberty Coalition, the Buckeye Institute and the 1851 Center Call to Action Ohio, State Treasurer Josh Mandel, Ohio Association of Conservative Congressional Churches and the Ohio Christian Alliance, the Cato Institute and the Heritage Foundation, Cincinnati Right to Life, and other Right to Life. What are other states doing? Well, there's 14 that will not participate in the red. And undecided, there's Tennessee, and let's see, okay, Ohio, I guess, yeah, I guess leaning towards participation. Ohio and Arizona, for example, they both fought the suit against the federal government, but they both, both governors go into it. So. And then it's undecided, but it seems like the more some of these governors change their opinion, other states are rolling with them to keep up with the money they're going to get from the federal government. Another option, Arkansas Governor Mike DB has negotiated with the U.S. Department of Health and Human Services an alternative to expanding Medicaid in Arkansas. The state will take the federal funds being allocated to expand Medicaid and use those funds to help purchase private health care insurance through the state health care exchanges for individuals earning up to 138% of the federal poverty level. The plan could require that up to 230,000 more individuals receive federal health care subsidies in Arkansas instead of 30,000 previously forecast. The CPO estimates that this will cost the federal government 50% more than expanding Medicaid, but probably a better system.
That's it.
Okay. We're going to open the floor for discussion and questions, but before we do that, because I was asked to, I'm going to read two letters. One is from the treasurer of the state of Ohio, Josh Mandel. I spoke to Josh this morning. Many of you have probably seen the letter that he's made public in opposition to the expansion already. But out of respect to the treasurer, I'm going to read this to you again. And then we have a letter who's also from Val Everett, who is the chairperson of the county Ward Leaders Association in Cuyahoga County. From Josh. Dear Speaker Batchelder and President Faber, as Treasurer of Ohio, I am charged as the state's Chief Fiscal Officer with the duty of overseeing the collection, disbursement, and safekeeping of public funds. Simply put, I act as a fiscal watchdog of Ohioans' hard-earned tax dollars. It is with my fiscal duties in mind that I write today and urge you to prudently consider the long-term financial implications of voluntarily implementing the Medicaid expansion in Ohio and to reject this expansion during the budget process. Though the federal government is promising to pay for most of the expansion in the near term, it is currently borrowing approximately 40 cents of every dollar it spends. I am concerned that the expanding Medicaid proposal in Ohio will overwhelm an already broken system and replace an unbearable burden on generations of Ohioans. I appreciate that you are being forced to choose between two undesirable options, because the Affordable Care Act, also known as Obamacare, was designed this way. Voting against the Medicaid expansion means that Ohio would receive less federal funding. Voting for the Medicaid expansion would, as I have described, burden current and future generations of Ohioans with even more federal debt and eventually increase the state's funding of Medicaid. While the proposed opt-out trigger is a well-intentioned safeguard to retract Medicaid's expansion if the federal government reduces its funding share, I am concerned whether such a safeguard would be honored in the future, because history has shown that once a government benefit is given, it is rarely taken away. There is no such thing as free money. While expanding Medicaid may direct more federal dollars to Ohio in the next few years, in the long term, Ohioans will have to repay the debt that is funding the federal government's spending. The federal government has an approximate $16.4 trillion national debt, and entitlement spending alone is projected to consume all revenue by 2045. If Ohio's leaders take the bait today, I fear that generations of Ohio taxpayers will be on the hook for the long-term costs of expanding Medicaid. As Ohioans, we share a common fate with all Americans. Whether taxed by the state or the federal government, the Ohio taxpayers of tomorrow will inevitably shoulder the cost of the debt-funded Medicaid expansion. For these reasons, I urge you to reject an expansion of Medicaid in Ohio. Sincerely, Josh Mandel, State Treasurer of Ohio. And from Val Emmert, who again is chair of the Cuyahoga County Board Leaders Association, which basically says she speaks on behalf of all of the ward leaders in Cuyahoga County. And the ward leaders are the chief, if you will, heads of the party in their communities. Now, I don't know that she brought this to any vote. So maybe I should say, she speaks for everyone in this instance, but she is the ward leader chair, and so she has a special position, and she asked me specifically to make her feelings on this matter known. She says, "Dear CDR members, due to an evening out with my mom, I will be unable to attend in person. However, I do want to share some information with you regarding the proposed Medicaid expansion. As a social worker who has worked in drug treatment and worked closely with Medicaid caseworkers and clients applying for or receiving Medicaid, I would like to present the following example for consideration as to why we should expand Medicaid and why some of the detractions are simply wrong, possibly because many of the experts opposing it do not have the insight that comes from working within the system. The current system provides that indigent persons who seek treatment, either at an ER or a drug treatment center, etc., are not turned away but are treated, and the treatment costs are refunded through various county, state, and federal indigency grants. As of now, if an agency or hospital's treatment costs exceed their grant allotment for the year, the costs are written off as losses. Poof. They disappear and the agency is never reimbursed for those services. Under the Medicaid expansion, the federal government intends to terminate the federal grants for indigency treatment. If the clients are not able to access Medicaid, the agency or hospital will have two choices: turn them away or treat them with no recourse or reimbursement of treatment costs. I am frankly disappointed in the false information and fear tactics being used to tank the governor's plan, and I expected better, at least from our side of the aisle. For example, first the opposition was screaming that Ohio would absorb the entire burden of expanded costs after 3 years, when in fact federal support will decrease from 100% only to 90%. Once they were corrected on this, they then tried to scare people into accepting that the Medicaid expansion guarantees an acceptance of Obamacare. Medicaid is a freestanding program that predates Obamacare. Changing its structure of administration on the state level is an entirely separate issue from Obamacare and its structures. Third, the opposition is claiming that these new patients will overload the system. These people are already receiving treatment. They aren't bleeding to death in the streets, so they are not new patients. In fact, covering them under Medicaid allows them to use normal channels for treatment, instead of always going to the ER, which is the most expensive treatment, of course. Please consider what I am sharing with you, and if you find it helpful, share it with others as you see fit. Sincerely, Valerie Emmert. The input from two leaders of the community.
Mr. Chairman.
Yes, sir. Okay. I was also just handed something from Congressman Fudge's office. They asked to read it on behalf of Congressman Fudge. And Brother Bob Sample, who is one of us, delivered it on her behalf this evening.
I'm also about Mama's husband. 20 years in office.
Yeah, he's also related to her, so he has an obligation. Congresswoman Fudge welcomes Governor Kasich's recommendation to expand Medicaid. Congressman Fudge welcomes the decision by Ohio Governor John Kasich to support expansion of Medicaid through provisions of the Affordable Care Act. She writes, I extend my appreciation to Governor Kasich for reaching a decision that will benefit all Ohioans. Currently, there are up to 600,000 uninsured people in our state who cannot afford health care coverage and are not eligible at this time for other health insurance programs. Medicaid expansion lifts a huge burden on working families, the recently unemployed, and other citizens who struggle to afford what others may take for granted. The ability to see a doctor or pay for medications to treat a serious health condition. As healthcare providers and prominent business organizations have also pointed out, Medicaid expansion is good for Ohio's economy. An independent study estimates Medicaid expansion will create over 30,000 new jobs in Ohio over 8 years, bringing $2.9 billion in new revenues to the state during that same period, and save Ohio employers $1.66 billion in healthcare costs through 2022. County governments can expect to see savings in mental health expenditures, which will now be reimbursed by the federal government, freeing up local revenues for new investments. On the other hand, failure to implement Medicaid expansion would cost the state millions of dollars and exact an unconscionable toll on the health of Ohio's residents. I urge members of the Ohio General Assembly to accept the governor's recommendation without delay and formally approve expanded eligibility guidelines for Medicaid. Sincerely, Congresswoman Marcia Fudge.
How about the last paragraph? Would you please,
Well, this is just background.
okay.
Mr. Chairman.
Well, she voted for the Patient Protection and Affordable Care Act.
Mr. Chairman.
Yes, sir, Marty. Do we have the other mic anywhere?
It wasn't working, though.
Wasn't working? We can share. Let me just say one thing, because I want to be cognizant of the fact there are people in this room, and we may not all realize it, who feel strongly one way or the other. So as always, all we ask is speak freely, but respectfully, cordially. We're all in the same house here, and just treat each other.
Thank you. At a recent meeting of the ward leaders, by the way, I'm one of them, this matter of voting as a block was discussed. And I resent the fact that somebody presumed to say that I was for this. I am not for the expansion of Medicaid. I know Valerie for quite a while. That's Miss Emery. And this very issue, not Medicaid, but speaking for other people, was brought up, and it was resoundingly trounced. Don't do it. I'll speak for me. I won't speak for Eddie Alvarez. He has a voice, he can speak. I won't speak for Marge. She can speak. But I am not going along with a blanket resolution saying that I'm for it. Thank you.
And I apologize if I misrepresented, because as I tried to explain it, she is the chair, but as far as I know, there was no vote, there was nothing taken. She does, however, have that position as chair of the board leaders, and I understand her to be speaking as such. Okay.
Good evening, everyone. Patty here. I was a little dismayed to see there wasn't a real statistic of the demographic that this would actually be netting into the Medicaid expansion. recently my husband and I, maybe some others that are here, attended the Southeast Republican Party where someone from the Buckeye Institute spoke. Is that right, Don?
Yeah.
Okay.
It's up there, there isn't.
Yeah, they are opponents of the Medicaid expansion. They did cite a study that patients with Medicaid had outcomes that were worse than those with no insurance. So I just wanted to put that in mind. Also, he mentioned something that the taxpayer dollars don't necessarily go into a pool where Ohio would be bringing money, our own money to be paid to the federal government back to Ohio. So that wasn't really, didn't see numbers on that. So if someone knows more than me, please speak to that. Also, the amount of able-bodied, healthier, younger individuals that wouldn't be really heavy using the system, that's who this would be aimed at, to pull into this dependency, which is something that we don't want to do. I would rather see a work requirement or a benefit to an employer that pulls an eligible individual into an actual job where they'd be maybe incentivized when they keep working, they would get better coverage. But let's start it off at Medicaid, okay. And the employer doesn't have to pay into that for their health insurance, but will. Anything to get people to work instead of at home with their free phone, waiting to get sick for lunch. Thank you very much.
We're going to walk around the room. Mr. Mizell.
Good evening. First thing is, I think we should get a better understanding. Currently, as Medicaid is structured, it's a program for welfare. It's a welfare program. I mean, you really have to be pretty much destitute or near broke to take advantage of Medicaid. It is not Medicare. Also, the whole structure of Medicaid began as a long-term care type of supplement for those who are poor, to take care of long-term care needs in their lifetime. Now, long-term care needs is not the same as hospitalization and doctors and Medicare. It's not the same. Now, I don't know for sure if this new regulation of expansion of Medicaid is going to improvise into it a Medicare benefit inside of Medicaid. That's not my understanding. So really, what is this all about? Really, the bottom line is that it's about the federal government, the progressive liberals, and the progressives on the other side as well, taking more control of our lives, and of course, every social program. They want 100% control. That's what this is all about. It's not about benefits. It's not about taking care of this poor person relative to that poor person. It's about control over every single one of us, regardless of our wealth. Regardless of our wealth. This is not a situation that we should be looking at with narrow blinders. Oh, certain people are going to get the benefit and certain people aren't going to get the benefit. It's about Kasich, in this case, wanting to act in this particular proposal like a rhino. Now, whether that motivation is for appealing to voters in the next election, that's up to him and for anyone else to decide. But basically, it's all about giving more power to the federal government. And I believe to support this program, you're also helping to eliminate the power and the structure of the 10th Amendment. So I propose that we vote this down flat and let them go ahead and correct the problems, the fraud and the waste that's in Medicaid and Medicare, and let's solve the problem and not look for the easy way out to get bribed to give away our power and our freedom. That's it.
Before we go, is there anybody who wants to speak on behalf. And again, I want everybody to, don't feel you can't. And then I'll go to, are you for or against, Marilyn? Okay. Well, let me do a 4, and then you're next for the.
Nobody's
Did you?
not in this room.
And folks, please try to be brief, just out of respect for everyone else, so we make sure everyone has a chance.
Brother Bob Sappho, what's that soldier? What branch of military you served in, brother?
Me?
What branch of military?
Army.
I'm a Marine from 1961 to 1968. I'm 77 years young. Thank you. I'll bring you greetings from the 11th Western District. The Honorable Marshall L. Fudge is the U.S. Rep. Her area starts downtown Cleveland and goes all the way southeast to Akron, Ohio, downtown Akron, straight out 77. The township of Bath, Richfield, and Fallon has been recently added to her district. Marshall represents some 700,000 people within our area. Times 42 times 700,000, 8 places, about 30 million people that she's responsible for. There's only one other African American got more juice and stronger than her, and that's the President of the United States of America. Marshall was born in Cleveland, raised up in Shaker Heights, where she graduated from Shaker Heights High with honors. She went to Ohio State University on an academic and athletic scholarship. She stands only about 5'3". When she was the point guard of the team that went to the quarterfinals in NCAA back in 1973 or 74, I believe. She's in the Big Heights Hall of Fame. Some of her best friends, his name is Congressperson Banner and U.S. Senator Rob Portman. They said they are. So, Marshall, and please don't take this outside. Any reporters in here? If she could get elected, she'd be one of us. She'd be a Republican. Because she's a business person first. And she knows in order for people to have jobs, we have to have business. That's why she's a businesswoman. She's a lawyer. It's just about that. I've been coming to these meetings, it's about the 4th to 4th, and I joined tonight because the agenda that was mailed to me on my email, it said there's going to be a debate with regard to this Medicaid. I've known Governor John Kasich since he was 29 years old when he was elected to the House of Representatives. He's a very, I hate to call the name for the people to understand, just understand, progressive and conservative. Those labels don't mean anything like they did 30 or 40 years ago. You don't know what it means, okay? But I know John Kasich is for the people, he's for us, and if you listen to the polls, he's stronger now than he was 2 or 3 years ago because he's moving Ohio forward. And he has all the information that we don't have. And that's why the main reason I'm supported because Governor John Kasich is, okay? And I'll vote for him and support him now and forever. When he's 16, he's going to be our next president of the United States. I believe that with all my heart because he's qualified, knowing what he's committed to moving this country forward, and he believes that everybody has an opportunity. Our previous speaker talked about Medicaid being a welfare. Social Security is welfare. The VA is welfare. According to his analogy, it's the same thing. And just wait a minute, please. I'm going to be very respectful. But that's an opinion. You can have these. I'm going to have mine, but I can assure you, okay? I don't have the access to the information, veterans programs, that Governor John Kasich had. If we're supportive of John Kasich, we will support this initiative he's making forward to expand Medicaid in Ohio. Thank you.
Okay. Mary.
Yes. Thank you. I just have 2 brief statements. One, I too am a city leader, and I would like to add my voice to that. My colleague who said that we did not vote, it was not discussed, and I think that Val should speak for herself. I would be one of those, had we had the discussion, with the information I have, and I'm not going to go through it, would have been opposed at that time to having any expansion of Medicare. One of Medicaid, yes. We have a speaker, someone, I think Patty referred to it, Mr. Robert Ault, from the president, of the Buckeye Institute, and he is the head of a large research group. One thing we need to know is that many doctors opt out of taking care of Medicaid patients because they aren't paid as much as if they were taking care of Medicare, which is a totally different program, and Social Security, which we all pay for, sir. It's not a welfare program. Anyway, I want you to know that in that program, I did not realize that the doctors had that option. So I think we need to keep that, and I totally agree with the gentleman who said, this is just another encroachment in our federal system of government. We have 50 laboratories. We need to use them and find out how we can cut costs, deliver better care, and let each state decide for themselves. If our money isn't spent here in Ohio, it's not going to be spent anyplace else. It's just for Ohio. Thank you.
Lest we forget, I would like to remind people that back in the mid-'80s, Congress came together and passed a tax bill ostensibly to squeeze some money out of the wealthier people in America. It was called the alternative minimum tax. And it was supposed to disappear at a point in time. But as time went by, and a lot of the middle class rose in the economic levels to higher earnings, the alternative minimum tax is now down to the middle class, and there's nothing in sight to rescind it. And the other thing too is my son-in-law is a doctor, and he and the men in his practice and the women in his practice do not take Medicaid patients. They have published a price list for people who want to see them, and it's been working for them because for the same reasons that people are aware and have been mentioned this evening. Their costs, their services have been cut tremendously, and when they were filing all the paperwork to the government, Oregon told me that they weren't getting reimbursed from anywhere from 10 months to a year and a half. Thank you very much.
I think my main point is that this is supposed to be the federal government giving us money. The federal government doesn't have any money to give us. That's right. It's just going to add more money to the debt. We have to stop this. If Ohio wants to take care of its less advantaged people, let Ohio come up with a solution itself and keep the federal government out of it. The federal government is broke, super broke. We can't be taking any federal money.
I don't normally speak, but I do want to share that with the election of our new Pope, I do believe that more people, more wealthier, more people that are advantaged, under his direction, we will be helping people that need the help. The churches will get behind and offer these people more.
Someone who had
As a healthcare professional, someone who has worked in an emergency room and has worked with billing departments in hospitals and in home health and hospice, I can tell you that when a patient goes into an emergency room who's on Medicaid, they plug that card down like it's a charge card. And I have seen more people abuse the system than I have seen those who really need it. Whenever the state of Ohio has a hearing on whether or not they should cut anything in Medicaid, all of the activists go around and find the very worst examples of sick people and rush them down to Ohio in wheelchairs and dollies and everything, telling the state that if you cut this Medicare, this poor person is not going to be able to live at home. We were taking care of people on the Medicaid waiver program who needed 24-hour days, 7 days a week care, plus all these safety devices. It costs twice as much to keep them at home as it did to put them in a nursing home, but the state of Ohio wanted to be able to say we kept them out of a nursing home. It's a fraud.
Many years ago, I did public health nursing on the Lower East Side of Cleveland. And I'll tell you, it has worsened so badly since that time. And I'm sure the cases that have increased have been by the thousands, not by the hundreds. It's just like busing. Once we started school busing, we ran into problems by cross-referencing our people and we thought we were doing them a justice. No. We contaminated good neighborhoods. I hate to think that, but it has happened. And as far as public health nursing now, today, I used to make it a habit of mine to visit emergency rooms just to listen to the conversations. And these people would tell each other, how many times have you been here this week? Because if I just sit around here and take up space, maybe I'll be lucky enough to come get some care today on public money. And that's the way they think. I hate to say that, but it's true.
I think honestly, the first thing we need to do is we need to get government out of the healthcare business. The government should only take care of our freedoms, protecting us against our domestic enemies, which unfortunately is the United States government, and their foreign enemies. The other thing we need to do, and there's never going to be any type of reform in the system, no tax reform, no anything, unless we get rid of the Federal Reserve. You can have all the spending cuts you want, but those printing presses, which are running 24 hours a day, 7 days a week, keep churning out money, any cuts in spending are going to be negated by the fact that all that money we're still borrowing at. Everyone thinks that China owns so much of this country. They own about $15.7 trillion of our debt, and the Federal Reserve owns the rest of it. So that's who we owe the most money to, is the Federal Reserve.
Okay. Anyone who hasn't had a chance to speak?